let's just take a look real quick at two quick studies just because they illustrate strong points about calcium scoring that you need to understand as a proactive patient. This first paper is from the New England Journal of Medicine a few years back and looked at calcium score over time, and as calcium scores increased in patients, what was shown was so did major coronary events, heart attacks, death, bypass surgery, etc. The take-home point of this slide, though, is the zero scores that you can see along the baseline, the orange graphic, the zero scores. A patient that has a zero coronary calcium score has a less than 0.5% chance of having a heart attack for the next 5 years, probably about as close to a guarantee as you're ever going to get in medicine. So it's that strong, what we call a negative predictive value from calcium scoring that really allows a patient to realize what you're doing is working, keep doing it. The next study I want to show you really illustrates, going back to when I was talking about the Framingham risk scores, the inaccuracy that can occur in your primary care doctor's office when relying on risk factors alone. And this particular study looked at over 3,500 people. All were intermediate risk, so the population we're talking about. All were given a calcium score to determine how many of these patients labeled as intermediate risk in primary care would really be high risk if we could look at their coronary arteries. And after having their calcium scores, this particular study revealed that 61% of patients that were deemed intermediate risk really were high risk once we could look at their coronary arteries. Now, conversely, 25% of the patients were able to be downgraded into low risk based on having zero scores. So in total, 86% of the intermediate risk patients out there in the primary care offices were being mislabeled, misclassified, and mismanaged because of relying on risk factors alone versus the calcium score. So you can see the huge potential opportunity here. Let's kind of wrap up with a case study of a very typical patient for calcium scoring, an intermediate risk patient. This is a 47-year-old female in to see her primary care doctor with concerns about her strong family history of heart disease. Her clinical background is she has slightly elevated cholesterol. Both parents had heart disease, as I mentioned, and her physical is normal, and she, again, is without symptoms or signs of heart disease at this time. So relying on Framingham alone, which is what's occurring in 95% of physicians' offices across America, her risk of having a heart attack or dying from heart disease is extremely low, less than 1 in 100 chance. So the appropriate response based on that data would be to provide reassurance and send her out the door. This physician had access, though, to a calcium score machine, sent her to the CT lab for a calcium score, and her score came back as a 106. If you recall, that places her in that moderately high category. When adjusted for her young age of age 47, it elevates her into the 90th risk percentile. For this score, we wouldn't expect to see a score of 106 in someone so young. Of course, her medical management changed dramatically from sending her out the door, reassuring her that she's healthy and fine, to an aggressive medical management strategy to try to stop the progression of plaque. And you can see on this next slide, you can actually see the images of her heart and her arteries. You can see they're in the circles there, and all those white nodules that you're seeing in those circles are all plaques. Those are all blockages in her coronary arteries that lead to heart attacks. Now, the key to this study, beyond showing the disease and the very typical nature of risk factors, is, if you remember, by Framingham alone, she would have been sent out the door believing her risk of either death or having a heart attack was less than 1 in 100. Now that we can see her coronary arteries via the calcium score test, we actually can see that her risk of heart attack or death are greater than 1 in 5. So a significant change in risk for this young lady. And of course, her medical treatment and medical management are changed accordingly. And the goal now is to stop the progression of plaque and prevent a heart attack from ever occurring.